Distinguished delegates, we are now going to open discussions on agenda item 18, review of and update on matters considered by the Executive Board. We will now discuss sub-item 18.2, updated roadmap for an enhanced global response to the adverse health effects of air pollution. The relevant documents are A78/4 and EB 156/2025/Reg/1, decision EB 156/33. Let me remind the delegates that the time limit for member states' remarks is 1 minute and 3 minutes for group statements. The floor is open for discussion. I will give the floor to Gambia, to be followed by Vietnam.
Thank you very much, Madam. I read the regional statement on behalf of the Africa region. Madam Chair, Director General, distinguished guests, colleagues, the Gambia is privileged to deliver the statement under the agenda item on behalf of the 47 African member states. The African region commends the World Health Organization for its continued leadership and welcomes the updated roadmap to enhance the global response to the adverse health effects of air pollution. We fully support the ambitious target to reduce population attributable mortality from anthropogenic air pollution by 50% by 2040, in alignment with WHO's 14th General Program of Work and the Sustainable Development Goals. Air pollution remains a serious threat to health and development, disproportionately affecting vulnerable populations, including children, pregnant women, the elderly, and those living in low-resource settings. In the Africa region, increasing urbanization and reliance on biomass fuel for household energy are contributing to a rise in respiratory illnesses and other pollution-related diseases. We are committed to integrating air quality considerations into national health planning, non-communicable disease strategies, and maternal and child health services. We particularly welcome the emphasis on building institutional capacity as strengthening national and local systems is vital to effective air quality management. To support implementation of the roadmap, we underscore the need for increased financial and technical support to African countries. Addressing existing data gaps through investment in air quality monitoring and information systems is crucial for informed decision-making. We also advocate for targeted capacity building initiatives to empower institutions and enhance health worker training so they can better diagnose and manage pollution-related illnesses. Integrating air quality considerations into broader national development frameworks with WHO guidance adapted to the African context is also essential. Additionally, strategies must be tailored to the unique environmental and socioeconomic conditions of African member states, and community engagement should be prioritized to raise awareness and promote protective actions. We support the roadmap's emphasis on regional collaboration and a One Health approach, recognizing that air pollution transcends borders. The Africa region remains committed to global solidarity, partnerships, and action to ensure clean air for all. Addressing air pollution is not only a matter of environmental stewardship, but also a matter of human rights and health equity. Let us act decisively, guided by science and solidarity. The African region notes the report and call on member states to adopt the decision. I thank you for your kind attention.
Thank you, Gambia. I now give the floor to Vietnam, to be followed by Philippines.
Thank you, Madam Chair. In recent years, Vietnam faced increasing air pollution, especially in major urban areas. This poses a significant threat to our socio-economic development and the well-being of our citizens. Some evidence-based studies have been revealed that air pollution in Vietnam is linked to an increasing prevalence of respiratory disease, COPD, cardiovascular disease, and even premature mortality. To effectively address the health effects of air pollution, we propose the following key strategies and policies. Firstly, investing in robust scientific research to gain a deeper understanding of the specific health impacts of air pollution is essential. Secondly, air pollution standards and policies must be both feasible and relevant to the country's context and capacities. Thirdly, close collaboration between relevant military, development balance, and acceleration is crucial for the effective formulation and implementation of policy on health quality control. Fourthly, it is vital to conduct public awareness campaigns to educate communities about the risk of air pollution and empower them to take protective measures. Finally, international cooperation plays a critical role.
Thank you, Vietnam. I now give the floor to Philippines, to be followed by Bahamas.
The Philippines supports the adoption of the roadmap for an enhanced global response to the adverse health effects of air pollution, as recommended by the Executive Board. The updated WHO roadmap sets an ambitious yet necessary target of reducing mortality from anthropogenic air pollution by 50% by 2040, emphasizing immediate action and integration into national policies by 2030. In an alignment with climate goals and SDGs, it highlights the strong role of the health sector in providing evidence, guiding multi-sectoral policy, and protecting vulnerable populations. The Philippines strongly emphasizes that the successful implementation of the roadmap will require sustained political commitment, intersectoral collaboration, allocation of adequate resources, and diligent and watchful monitoring to address disparities in baseline capacities across countries. Thank you, Chair.
Thank you, Philippines. I now give the floor to Bahamas, to be followed by Ecuador.
Thank you, Chair. The Bahamas notes the 4 projected outcomes of the Roadmap 2025 to 2030 and fully endorses the Secretariat in its work to attain the same. Noting the need for clean and fresh air for healthy growth and the enjoyment of life, we believe that every effort must be made to not only monitor the existing circumstances, but also to implement strategies to reduce air pollution while finding ways to remove the pollutants that currently exist. The Bahamas notes that 7 of the 11 of the 12 actions in the roadmap are already included in our recently launched Health National Adaptation Plan for Climate Change and Health. And we look forward to the initiatives and funding that will be made available to member states to aid in meeting clean air quality standards, health information and education on the impact of low air quality on health, training of health practitioners to manage the effects of poor air quality on health, and implementing systems for monitoring, reporting, and advocating for cleaner air. In conclusion, the Bahamas endorses the roadmap but calls for a midterm report on the progress of the plan at WHA 80 or 81. Thank you.
Thank you, Bahamas. I now give the floor to Ecuador, to be followed by Monaco.
Thank you, Chair. If I may ask you for a few minutes before I take the floor. Thank you.
Okay, thank you, Ecuador. I now give the floor to Monaco, to be followed by Brazil.
Merci, Madame la Présidente.
Thank you, Madam Chair. The Principality of Monaco thanks WHO for the update on the roadmap for an enhanced global response to the adverse health effects on air pollution. Monaco remains fully committed to seeing environmental and climate factors being better taken into account in terms of their impact on human health. We are in favour of a cross-cutting approach and a collaborative one to address these issues in an effective and coordinated manner. The Principality is actively participating in these global efforts, particularly through implementing WHA 78.3 resolution from 2015. Monaco encourages all member states to take note of the importance of the updated roadmap for our collective efforts. Thank you.
Thank you, Monaco. I now give the floor to Brazil, to be followed by Peru. Madam Chair, in light of the updated roadmap, we would like to highlight the active participation of the Brazilian delegation at the second WHO Global Conference on Air Pollution and Health. During this important meeting, we emphasized the success of interministerial cooperation in Brazil, which has been instrumental in advancing strategic achievements, such as the establishment of the National Air Quality Policy, the update of national air quality standards based on WHO guidelines, and the implementation of monitoring systems to assess the impact of air pollution on mortality. We also highlight the development of our National Climate Plan, which places a strong emphasis on equity and fair transition. We reaffirm our appreciation to WHO for its leadership and continued commitment to this coalition for clean and healthy air for all. Thank you. Thank you, Brazil. I now give the floor to Peru, to be followed by Panama.
Muchas gracias, señor.
Thank you, Madam Chair. Peru welcomes the updated roadmap for an enhanced global response to the adverse health effects of air pollution. My country has created specialized technical organizations on environmental health, and we also have a national health policy that is multi-sectoral. This has a comprehensive multi-sector vision. In this way, we have cut mortality rates in half for those caused by air pollution. All of this thanks to dialogue and to the priorities chosen by our country. We feel it is essential to continue with these efforts. Health must be a priority in the public policies of member states in order to take preventive measures, particularly for the health of the most vulnerable populations. Thank you.
Thank you, Peru. I now give the floor to Panama, to be followed by Norway.
Buenos días, señora.
Good morning, Chair. Panama notes the report on the updated roadmap for the enhanced global response to the adverse health effects of air pollution and urges member states to adopt this roadmap. Panama is making progress in compliance with various parameters through national initiatives such as campaigns at municipal level, capacity building in the health sector, and guidelines on air quality. We highlight the need to keep working to fight against air pollution and to see the roadmap being implemented in this way. We highlight the need for cooperation within the UN system when it comes to the link between climate and environment and air quality. We urge countries to step up their efforts to respond to the adverse health effects of air pollution by creating policies and rules to implement this roadmap. Thank you, Madam Chair.
Thank you, Panama. I now give the floor to Norway, to be followed by United Kingdom.
Thank you, Chair. Norway acknowledges the detrimental health effects of air pollution for humans, animals, and the planet, and welcomes the updated roadmap. The successful second global conference on air pollution and health committed countries, cities, academia, organizations, and individuals to accelerate action. The updated roadmap can guide us all in our responses. We need research and air quality surveillance data for informed policy making, strong institutions, trained healthcare workers, and health leadership. We welcome the focus on vulnerable groups and equity. Norway's support to WHO work in this area will continue and will encourage a focus on interlinkages between climate, environment, and air quality across sectors and various stakeholders. Thank you.
Thank you, Norway. I now give the floor to United Kingdom, to be followed by Iran.
Chair, the UK notes the WHO's report and recognises air pollution as a major health and environmental risk, responsible for millions of deaths annually. We welcome the WHO's efforts, including the Global Conference on Air Pollution in Cartagena, and strongly support its target to reduce health impacts by 50% by 2040 relative to 2015. The UK encourages other member states to join this commitment. We also support the adoption of the roadmap and urge the WHO to collaborate with partners, including other international organisations, on air quality to ensure a coordinated global effort. Addressing this issue is critical for public health, climate change and economic growth, and we remain committed to the WHO's initiatives in this field. Thank you, Chair.
Thank you, United Kingdom. I now give the floor to Iran, to be followed by Burkina Faso.
Thank you, Chair. Addressing air pollution through the establishment of early warning system and guidelines for managing is a government priority. To enhance the roadmap effectiveness, we propose setting interim 2030 target and a long-term goals of reducing pollution-related mortality by 50% by 2040. Showcasing successful policies could provide valuable insight for policymakers. Accelerating progress in air pollution control required national measures, including private sector. Moreover, increased investment in research on the health impact of pollution facilitate evidence-based policy making, enhance the effectiveness of policy implementation, and strengthens stakeholder engagement. Thank you.
Thank you, Iran. I now give the floor to Burkina Faso, to be followed by China.
Merci, Madame la Présidente.
Thank you, Chair. Burkina Faso has taken a number of initiatives as we are aware of the risks related to air pollution. We have drafted a National Health and Environment Plan for 2020-2026 and a plan for adapting the health sector to climate change. In 2021, we also studied exposure of households to air pollution, and we have worked to mitigate the harmful effects on health of this pollution. We welcome the technical support from WHO and call for this to be reinforced. We take note of this report and call upon the Assembly to adopt the updated roadmap for an enhanced global response to the adverse health effects of air pollution. Thank you, Chair.
Thank you, Burkina Faso. I now give the floor to China, to be followed by India.
Thank you, Chair. China highly appreciates the WHO's...
Thank you, Chair.
优先发展战略，推动能源产业结构优化与交通领域绿色转型。
And green transformation in the transport sector, we are formulating stricter air quality standards and advancing technologies such as AI and big data in pollution source analysis.
So could you please start again from the beginning? Thank you.
Chinese government attaches great importance to air pollution control and will continue to actively participate in implementing the global roadmap. We adhere to a health-first development strategy, optimizing the energy and industrial structure, as well as green transformation in the transport sector. We're formulating stricter air quality standards and advancing the application of technologies such as AI and big data in pollution source analysis, pollutant monitoring, health risk assessment, and other interventions. China also actively participates in establishing cross-border air pollution monitoring and early warning systems. We call on the WHO to fully consider the inequality in health effects of global air pollution and to increase financial and technical support for key and vulnerable regions. China stands ready to work with other countries to share experiences, jointly implement the global roadmap, and build a clean, healthy, and sustainable planet for all. Thank you.
Thank you, China. I now give the floor to India, to be followed by Bahrain.
Thank you, Chair. India acknowledges the updated WHO air pollution roadmap, which provides a clear direction. By 2040, we must reduce mortality from air pollution through 4 strategic pillars: expanding evidence, measuring health impacts, strengthening institutional capacity, and demonstrating global leadership. India strongly supports a multi-sectoral response to address air pollution, adopting coordinated action across health, environment, transport, energy, urban planning, and industry sectors to implement integrated policies that reduce emissions, improve air quality, and protect health. Air pollution knows no borders. Engagement of environment and health sectors of all countries in the Southeast Asia region would be useful to secure a healthier and resilient future for all. Let us act now together and advocate for clean air for all across the globe. Thank you, Chair.
Thank you, India. I now give the floor to Bahrain, to be followed by Spain.
Madam Chairperson, the Kingdom of Bahrain affirms the importance of developing surveillance systems in order to foster and protect public health from the effects of chemical and waste materials, and the protection of the health of the elderly and the young. And in this regard, the Kingdom of Bahrain has implemented a number of measures with regard to facing the chemical, biological hazards, and also in regard to the classification of chemical materials and their branding as such. The ministry has also been working on the classification of hazardous chemical materials in 2020 according to the best international standards to the management of hazardous chemical waste. Thank you, Madam Chairperson.
Thank you, Bahrain. I now give the floor to Spain, to be followed by Kenya.
Muchas gracias.
Thank you, Chair. Spain aligns itself with the statement delivered on behalf of the European Union and its member states. Air pollution is part of our triple global crisis and is an urgent threat to public health. This is why we need a multi-sectoral approach. It affects everybody, especially the most vulnerable populations. It needs international cooperation and an intersectoral approach to health. We firmly support the updated roadmap to cut the mortality rates by half when it comes to air pollution by 2030. We support the scientific efforts at global level, and we in Spain are strengthening our surveillance, our public health surveillance, and promoting research into air quality. We're training professionals in this sector as well. Thank you, Chair.
Thank you, Spain. I now give the floor to Kenya, to be followed by Barbados.
Thank you, Chair. Kenya aligns this statement with that delivered by Gambia on behalf of the 47 member states of the African region. Kenya recognizes the health risks posed by air pollution and strongly supports the adoption of the proposed global roadmap to enhance these efforts. Kenya has made significant strides in these areas, including through prioritization of clean energy for health facilities and households as part of our nationality-determined contributions, development of the Kenya Air Pollution Prevention Strategy, scaling up of the adoption of the non-ban technologies for treatment of medical waste, establishment of the Kenya Air Pollution Center of Excellence. To fast-track the realization of priority actions in the global roadmap, Kenya urges for resource mobilization, for capacity building, research, enforcement of laws and policies, and awareness creation on the impact of air pollution to health. Thank you.
Thank you, Kenya. I now give the floor to Barbados, to be followed by Sri Lanka.
Honorable Chair, Barbados congratulates the Secretary on the updated roadmap for an enhanced global response to the health effects of air pollution and fully supports stronger, coordinated global action. Although air pollution and its health impacts have not yet been formally researched or monitored in Barbados, existing knowledge and international guidance have informed national action. The Health Services Smoking Regulation 2017 empowers the health sector to restrict smoking in public places and limit youth access to smoking devices, important steps towards protecting public health. To address broader air pollution risks, including occupational, indoor spaces, and mold exposure, greater investment is needed to strengthen our detection, prevention, and mitigating capacities. Barbados remains committed to advancing this agenda and working together to reduce the health impacts of air pollution.
Thank you, Barbados. I now give the floor to Sri Lanka, to be followed by Ghana.
Thank you, Chair. Air pollution, including transboundary sources, is a growing public health challenge, contributing significantly to non-communicable diseases and children's health burden. It disproportionately affects children, pregnant mothers, and both indoor and outdoor workers, demanding urgent multi-sectoral action. We highlight the need to strengthen health impact assessment and evidence-informed standards to drive national policies. Community engagement and empowerment are critical to address behavioral, household, and occupational exposures. Effective strategies to build public awareness, participation, and accountability must be identified and supported. We call for WHO to strengthen country-driven research, address evidence gaps, and build capacity to protect health and promote air quality equity. Thank you.
Thank you, Sri Lanka. I now give the floor to Ghana, to be followed by Uruguay.
Ghana is thankful for the opportunity to comment on the agenda item 18.2 and aligns itself to the statement delivered by Gambia on behalf of the 47 member states of the African region. We commend the Director General and the Secretariat for the detailed report and note the need for addressing the pollution with the country regional context. The global response to the diverse health effects of air pollution evolves in a multifaceted approach, including policy changes, technology advancement, and public awareness campaign. Ghana recognizes the key role the WHO continues to play in developing roadmaps and resolution addressing the issue with UN Environment Program. Ghana aligns with key components of global response, including policy, legislation, and has sector-specific policy guidelines to address air pollution, which cuts across different sectors of economy under the tenets of health policy. This includes the enactment of EPA Act 225, Act 11211, Fleet Renewal Policy 2010, air quality by encouraging the use of newer, less pollution vehicles, waste management policy on waste recyclation, waste to energy process, initiative in Accra.
Thank you, Ghana. Ghana, your microphone is switched off. Thank you. I now give the floor to Uruguay, to be followed by Thailand.
Gracias, señora.
Thank you, Madam Chair. Uruguay welcomes the update of the roadmap and shares concerns for the impact of air pollution on health. In my country, we work to ensure that air pollution levels comply with international standards, and they do, but we still face challenges in urban areas. Efforts such as awareness raising, epidemiological surveillance, and the promotion of clean energies are a priority. We have identified key pollutants in our capital, and we have a decree which is aligned with the WHO standards on air quality, although we are facing technical and financial challenges when it comes to expanding our surveillance efforts. We firmly support this roadmap, and we underscore the need for international cooperation to ensure its effective implementation by strengthening international cooperation and taking more ambitious steps in sectors such as industry and transport. Thank you.
Thank you, Uruguay. I now give the floor to Thailand, to be followed by Japan.
Thank you, Chair. The Thai delegation supports the updated WHO roadmap. Thailand places air pollution as our national priority. We are implementing cross-sectional measures to improve air quality and protect vulnerable populations. Prominent example of this effort includes strengthening community action to prevent open burning, promoting the use of electric vehicles, establish early warning systems, and providing clean air shelter for children. At the same time, reducing emission at source through regulation and target incentive is most essential. Air pollution knows no border. We must underscore the urgent need for a strong and sustainable global collaboration towards clean air and better health for all. Thank you, Chair.
Thank you, Thailand. I now give the floor to Japan, to be followed by Colombia.
Thank you, Madam Chair. Recognizing the health impacts of air pollution remain a major global concern. We commend the WHO's leadership in advancing the cross-sectoral agenda, including through the convening the second Global Conference on Air Pollution and Health in March 2025, and the update of the roadmap. Japan is committed to contributing to the reporting on the implementation of the roadmap towards 2030, as outlined in the current progress report, not only through the domestic efforts, but also by sharing knowledge and experiences at both regional and global levels. I thank you, Madam Chair.
Thank you, Japan. I now give the floor to Colombia, to be followed by Chile.
Gracias, señora Presidenta.
Thank you, Chair. We welcome the report and the updated roadmap and the draft decision, which Colombia supports. We highlight the severity of air pollution as one of the biggest environmental risks to health, especially in urban areas where industrial and automobile emissions affect quality of air. We especially thank all delegations who participated actively in the second Global Conference on Air Pollution and Health in Cartagena in March this year, where we shared experience and national challenges in this area. On the roadmap, Colombia calls for the inclusion of the commitments made at the conference, the reduction of short-lived pollutants, and effective communication to the public. We also highlight the need to strengthen monitoring and surveillance mechanisms and also reinforce local analytical and health capacities. Thank you.
Thank you, Colombia. I now give the floor to Chile, to be followed by El Salvador.
Gracias, señora Presidenta.
Thank you, Chair. Chile welcomes the Director General's report and the ambitious goal to cut by half deaths due to air pollution. This can be achieved by collective efforts. We welcome the efforts made in the previous period. We believe it is essential to implement this roadmap for 2030. Air pollution affects individual health and most especially the most vulnerable populations. We call for the efforts of the UN system to work together with member states to achieve the SDGs. Under our National Climate Change Adaptation Plan, we take an intersectoral approach to health, and health efforts such as education, safety, and the environment are designed to benefit all. Along with technical support from PAHO and WHO at a regional level, we have addressed these challenges, and we have some successful examples in terms of capacity building to cut the number of deaths attributable to air pollution. We still need capacity building to collect data and develop more knowledge, and also to monitor progress. This is a challenge that we will tackle in the upcoming period. We support the project as it is presented. Thank you, Chair.
Thank you, Chile. I now give the floor to El Salvador, to be followed by Ecuador.
Gracias, Presidenta.
Thank you, Madam Chair.
Gracias, Presidenta. El Salvador.
Thank you, Chair. El Salvador supports this updated roadmap to improve air quality. We are aware of the need to make effective changes to prevent air pollution exacerbating existing illnesses and for new diseases to emerge. We support the use of renewable energy and low carbon energy. We must make these efforts in a One Health approach at global level to make these important achievements for health. We depend on air to live. Thank you.
Thank you, El Salvador. I will now give the floor to Mexico, to be followed by Libya.
Gracias, señor.
Thank you, Madam Chair. Mexico firmly supports the adoption of the updated roadmap to enhance global response to the adverse health effects of air pollution. We agree with WHO that this is an urgent threat. In our country, although we've upgraded our official regulations, but our authorized limits are still beyond the WHO limits. In 2024, only 14% of days in the Mexico Valley metropolitan area met standards. Mexico is working to develop a surveillance system, and we are working with various intersectoral technical groups to do so. We need to strengthen our ability to measure progress, strengthen our institutions and leadership to implement this roadmap. We value the technical support from WHO and recognize its key role in implementing this collective effort. Thank you.
Thank you, Mexico. I now give the floor to Ecuador, as I think that you had some problems with the microphone.
Gracias, señora presidenta.
Thank you, Madam Chair. Ecuador welcomes the joint WHO-PAHO effort to strengthen the global response to the adverse health effects of air pollution via this roadmap. We agree with its strategic objectives, which are focused on reducing exposure to air pollution, strengthening surveillance systems, promoting intersectoral public policies, and raising awareness about these risks. Ecuador is promoting strategies and initiatives, working with the environmental authorities at national and local level to implement air quality monitoring rooted in epidemiological surveillance. This is designed to reduce exposure to pollution, provide accessible health services, and promote research. We recognize that the risks related to air pollution are a threat to public health. We call for comprehensive cooperation among governments. I thank you, Chair.
Thank you, Ecuador. I now give the floor to Libya, to be followed by Burundi.
شكرا سيد الرئيسة يشرفني أن ألقي هذا البيان.
Thank you, Madam Chair. I have the honor to deliver this statement on behalf of the member states of the Eastern Mediterranean region. Air pollution causes approximately 6.8 million premature deaths annually worldwide. Around 85% of those deaths are attributed to non-communicable diseases, including ischemic heart disease, stroke, chronic obstructive pulmonary disease, and lung cancer. Unfortunately, implementation of WHO's previous air pollution roadmap was inadequate. The current draft roadmap updates the initial version and outlines several key interventions where the health sector can play a critical role in addressing the health impacts of air pollution. It also proposes a clear and ambitious voluntary target to address the health impacts of air pollution. While the health sector works to reduce its emissions, as mandated in Resolution WHA77 on climate change and health from last year's World Health Assembly, it must also advocate for action to reduce air pollution at sources beyond the health sector, including areas such as the environment, energy, and transportation.
Libya, as I understand, you presented the statement for the region. Am I right? Livia, please confirm if it is a regional statement.
Yeah.
Please repeat. Because if you have a regional statement, you will have 2 additional minutes.
هو بيان إقليمي.
It is indeed a regional statement, Madam Chairperson, on behalf of the Eastern Mediterranean.
Thank you.
Please proceed.
The main goal is to accelerate action for clean air, clean energy access, and climate change mitigation, and to highlight evidence-based, coordinated, multi-sectoral solutions in cities, countries, and regions. Effective action now can prevent communicable and non-communicable diseases, save lives, protect child health, and limit climate change across the world. Reducing air pollution emissions will improve public health and help mitigate climate change. The Eastern Mediterranean region has the highest air pollution levels of any WHO region. Although natural sources such as sand and dust storms are a significant factor, addressing anthropogenic sources is crucial to improving air quality in the region. On behalf and in conclusion, on behalf of all member states in our region, we recommend adoption on the financing of the new draft roadmap, and we call on the Director General to report on progress in implementing it to the 83rd World Health Assembly held in 2030. Thank you.
Thank you, Libya, and apologies for the interruption. I now give the floor to Zambia, to be followed by Russian Federation.
Chairperson, Zambia aligns with a statement delivered by the Gambia on behalf of the African region. Zambia aligns itself with the WHO 14th General Program of Work's call for promoting low-carbon societies and a primary healthcare approach to tackling the critical environmental determinants of health and mitigating climate change. The health sector, like other sectors, is expected to be severely affected by adverse health effects of air pollution, hence working in progress to achieve a 50% reduction in the population attributable fraction of mortality from anthropogenic sources of air pollution by 2040. The country has developed robust interventions to address the challenges related to global response to adverse health effects of air pollution, which include prioritized climate change mitigation and adaptation interventions in the National Health Strategic Plan, conducted vulnerability and risk assessment to climate change, pollution promotion of climate resilient infrastructure, promotion of non-incineration methods. I thank you.
Thank you, Zambia. I now give the floor to Russian Federation, to be followed by Bangladesh.
Thank you, Madam Chair. Chair, we note that when it comes to an appropriate and uniform approach to driving down air pollution, we need every 3 to 5 years to look at the results of epidemiological surveillance and studies and to issue updated indicators as to when there is a risk to health. However, we have to carefully analyse all of that data in order to identify adverse impacts on health. And here we see that WHO has a clear role to play in doing precisely that and producing updated roadmaps as it does. Thank you.
Thank you, Russian Federation. I now give the floor to Bangladesh, to be followed by Burundi.
Thank you, Chair. Bangladesh welcomes the updated roadmap and supports its adoption. We hope that 4 key responses of the roadmap, improving evidence, tracking progress, strengthening institutions, and promoting global coordination, will induce a paradigm shift to our traditional approach to improving air quality. Bangladesh has enacted air pollution control rules and launched air quality management plan. These are aimed at reducing air pollution for better air quality. We are piloting a WHO UNDP-backed behavioral trial in our capital to raise public awareness. Sector-specific action like phasing out unfit vehicles, improving brick-kilns, and promoting cleaner household cookings are underway. We urge for continued technical assistance, policy tools, and targeted financing to translate the actions of the roadmap into reality, especially for vulnerable urban population. Thank you, Chair.
Thank you, Bangladesh. I now give the floor to Burundi.
Thank you, Madam Chair. Madam Chair, Burundi associates itself with the statement delivered on behalf of the 47 member states of the Africa region. Indeed, air pollution is a significant threat to public health. and it has adverse effects on health, especially in rapidly expanding urban areas. We therefore strongly support adoption of an updated roadmap for enhanced global response to the adverse health effects of air pollution. This is a key strategic tool for us. We can use it to guide policy making, to enhance multi-sectoral cooperation, and to protect the most vulnerable in our societies. We call for accelerated and equitable implementation of this, with due account being taken of regional and national priorities. Thank you.
Thank you, Burundi. As I have no more delegations on my list, I would like to invite the representatives of the United Nations and international organizations to give their remarks. Are there any requests for the floor? I see none. Several non-state actors in official relations with WHO have requested the floor on this sub-item. I shall first give the floor to the representative of Union for International Cancer Control, to be followed by NCD Alliance.
Honourable Chair, distinguished delegates, UICC welcomes the development of the updated roadmap, as IARC has classified outdoor air pollution as a Group 1 carcinogen since 2013. And a Lancet Commission estimates that up to 29% of lung cancer deaths, the most common cancer globally, are attributable to air pollution. We therefore applaud the proposed target to reduce mortality from anthropogenic air pollution by 50% by 2040. We also urge all member states to adopt the roadmap and integrate that target into relevant national strategies, drawing on the guidance from the WHO compendium. To recognise people with cancer and other NCDs as a vulnerable group in relevant national policies and programmes, and to include practical, time-bound and measurable air quality commitments in the upcoming political declaration on NCDs, focusing on maximising the co-benefits of clean air action for people living with NCDs. Thank you.
Thank you. I now give the floor to NCD Alliance, to be followed by International Federation of Medical Students Associations.
Honourable Chair, distinguished delegates, each year air pollution costs governments around $8.1 trillion USD and causes over 8 million deaths, nearly 90% due to non-communicable diseases. Despite the human and economic burden, air pollution interventions have not been adopted at the scale and pace needed to meet NCD targets. NCD Alliance welcomes the updated roadmap and its overall target to build further momentum for clean air action and ask member states to adopt it. When implementing the roadmap, we urge member states to fully integrate air pollution action into national NCD plans, prioritize interventions to reduce fossil fuels use as the major driver of air pollution and climate change, seek other co-benefits, including around active transportation and sustainable food systems, and reiterate WHO's mandate to produce a menu of best buys on air pollution. Thank you.
Thank you. I now will stop non-state actors, and I will give the floor to Ethiopia.
Thank you very much, Madam Chair, and apologies for taking the floor delayed. Ethiopia aligns with the statement delivered by the Gambia on behalf of the 47 member states of the African region. Ethiopia welcomes the report and affirms its commitment to addressing the impacts of air pollution. We have taken important steps, including developing national guidelines for hazardous waste, establishing a poison center, and phasing out mercury thermometers, and also signing an MOU in support of these prevention efforts. Our air we also have integrated clear air action into national strategies, trained health workers, and promoted household-level interventions, such as improved stoves and cooking clean solutions. We also advanced green urban policies, including car-free days and incentives for electric vehicles. We called for enhanced support in air quality monitoring, institutional capacity, and sustainable financing for strengthening health pollution from environmental risks, especially for vulnerable populations. Ethiopia takes note and supports the decision. Thank you.
Thank you, Ethiopia. I now give the floor to International Federation of Medical Students Associations.
Distinguished delegates, in 2021, air pollution was responsible for approximately 8.1 million premature deaths globally, making it the second leading risk factor for deaths worldwide. Of these, about 5.1 million deaths, approximately 61%, were directly linked to fossil fuel combustion. This equates to roughly 1 in 5 deaths globally. Phasing out fossil fuels would yield the largest reduction in deaths in South, Southeast, and East Asia, preventing about 3.85 million deaths each year, with another 460,000 deaths being prevented in high-income countries. We urge countries to adopt ambitious and costed climate health policies, divest public funds from fossil fuels, sign the Fossil Fuel Non-Proliferation Treaty, and transition health systems to clean, renewable energy. Thank you.
Thank you. As there are no more speakers on my list, I would like to give the floor to the Secretariat to respond to any questions raised. Dr. Alian Lee, Assistant Director General, Universal Health Coverage, Healthier Populations. You have the floor.
Thank you very much, Chair. Excellencies, dear colleagues, thank you very much for your guidance, but very strong support on this agenda item. I'm very pleased to highlight 2 points that are commonly mentioned by many member states and partners. First, on prevention. Most of the 7 million deaths linked to the air pollution each year are preventable. We have taken note of your call to advance the work through multi-sectoral approach and also integrated approach on air pollution, energy access, climate change, and health. The updated roadmap and the voluntary target will empower health sector as well to lead and contribute to clean air and energy actions to improve everyone's health. In a complex global context facing budget constraints, we are very grateful to see that you all would like to strengthen WHO leadership role on strengthening the health impact of the air pollution, including through tailored country support. Secondly, normative and standard setting go hand in hand with member states' commitment to support this work. For decades, WHO has provided countries with evidence-based guidance to address air pollution while also monitoring progress made, including for Sustainable Development Goals. Following the March 2025 Global Conference on Air Pollution and Health, we will continue to strengthen our normative function and drive progress across the UN systems to promote health and safe lives. We thank Colombia for hosting the conference. I think this is quite historical, and to all the member states for your leadership to ensure a healthier, more equitable, and sustainable future. Thank you very much. Thank you, Chair. Back to you.
Thank you, Dr. Lee. Is the committee ready to note the relevant sections pertaining to this discussion of the consolidated report as contained in document A78/4? I see no objection. The report is noted. We shall now consider the draft decision as contained in document EB 156/2025/Reg/1, decision EB 156/33. Is the committee ready to approve the draft decision? I see no objection. The decision is approved. That concludes our discussion of sub-item 18.2.